Okay, so this is my name. So this is the presentation our academic counselor has sent to me this afternoon. That's a Master of Science in Global Health. So of course we are talking about global health. And global health is a concept that is not well known by everyone. I think since the pandemic, it's easier for a lot of people to understand what are global health issues. And it's what we are dealing with this program. So global health issues basically are issues that, so health issues that transcend national border, and states can't deal with these issues alone, okay? So they have, to collaborate and try to collaborate with other states, international organizations, etc., at the international level in order to, try to find solutions. Global health is, as a discipline, it's quite a complex discipline because I told you I am a lawyer working in this field, meaning I will address, or I do address, global health issues with a legal approach. But my colleagues come from different faculties. We have colleagues from the medical faculty, of course, but also from, specialists on demography, specialists on geography. We have economic experts in economics, veterinary. What do we have? Humanitarian health, public health. So we have, that's actually an interdisciplinary program. Meaning that you have to, you have to integrate the methodologies from different disciplines and be able to work with information that comes from disciplines that are not your field of expertise, okay? I have a few slides regarding, I don't know if, you will have, I will give you the floor in a minute, but I have some information regarding candidacy. So you find this information online as well, what we, this is part of your application. We want students with at least a bachelor degree. This year we had 350 candidacies coming from all over the place. People from different disciplines, different countries. It's really international. 300, I think the year before we had a bit less, but I think we had something like 300 candidacies. This year I selected 60 students. Only 30 came, and that's a tricky part for me as a director, because you select people, and 30 is a good number actually. The year before I think I selected 60 as well, but you were only 22 or 23. Yeah. So it's really hard to know how many students are going to join. What I see is that a lot of people are interested in the program. So these are the requirements for your application if you are interested. This is in short how the program is structured. That's a 2 years program. First year, so you have to get 30 credits per semester, 60 credits during the first year and 60 during the second. I think we have more details here. So in the first semester we try to, and that's mandatory now, you have the obligations to acquire methodological knowledge. So you get a training in quantitative, qualitative methods, and you have the possibility to take additional courses. Also, we have an introduction into law and legal issues. During the second semester, the idea is to develop further or use these methodologies in different areas. You continue during the third semester, and there is one semester that is dedicated to an internship and the preparation of a master thesis. So far, so good. These details regarding the different classes, you can find these details online if you look at the Programme des cours. So these are the courses that are offered this semester. As I said, you have some classes about methods, and then global health policy, governance, introduction to law. We have a class on health inequalities, drug policy, food systems. This can change from one year to the other, depending on normally it's quite stable. The classes are quite stable, but we have modifications sometimes. Second semester, I give a class or a course on global health law. As I said, my colleague, who is a professor of geography, gives a course on geospatial approaches in global health. We have one on sexual and reproductive health, humanitarian health, health economics, planetary health, One Health and planetary health, and we have one course on pharmaceuticals globally. And that's the third semester, where you can have additional courses depending on the ones you have chosen in the first semester. I have two more slides. One concerns the possibility to take, that's during the second year. You have the possibility to take classes with, other academic institutions that are working with us in partnership. There is one partnership with the Graduate Institute here in Geneva. We have a strong partnership with Swiss TPH in Basel. And there are other possibilities to take classes. So instead of classes in the third semester only in Geneva, you also have, that's like a more global program with the University of Geneva. You have the possibility to take classes where we have these relationships. The third semester here with the master has been developed for students for the master program. So they are specific for global health and deal with global health issues. So if you are, I would say, more interested in epidemiology, you have to go to Basel. If you are, willing to address specific issues that are connected with diplomacy and international relations, there is this possibility at the Graduate Institute. So that's what we offer. I must add that we have also partnerships with some universities abroad. We have one partnership with the School of Public Health at the Tsinghua University in China. We have a partnership with Melbourne University. These partnerships are really specific to our program. And there is an additional stronger partnership actually with the Graduate Institute, because for a small number of students, there is a possibility to do what we call, I think I have this, no, to do a dual master program, meaning that instead of doing 2 different masters, you can start with us and 2 years, and you can add 1 additional year or work with the graduates 1 additional year, and then you will have 2 master's degrees. Okay, so that's a very specific program. These are questions that are obviously frequently asked regarding the tuition fees. Well, the tuition fees at the moment haven't changed and are the same for all students. So 500 francs per semester, which is really cheap. I know Geneva is an expensive place, but you have masters in global health in cities that are also extremely expensive, and their program on top of that are expensive. There are no scholarships, that's a reality. Can these masters be done online? The answer is no. What we have, part-time studies, that's a possibility we offer as well. So if you are working part-time, you can have, we can find a solution. And the last questions concern candidates who have already a master degree when they start, and we can recognize some credits that will be used actually instead of you doing the 3rd semester and working in order to get the 30 credits. There is the possibility that we recognize the credits, or we, acknowledge the credits for your previous master degree. I think that's you could have done that, right?
I think I could have, but
yeah.
I never did.
Okay, no, that's good. Okay. As I said at first, if you have very specific questions regarding, your application or the program, please reach out to our academic counselor. Yeah, I think that's it. Maybe if there are no questions at this point, I could very shortly give the floor to our 2 students so they can tell you, rapidly why they applied, or, you are free, but I don't know, I was thinking why you applied, or what did you enjoy, or I hope you enjoyed the program so far. Yeah, your I don't know if you have advice to give, or...
Were there any questions before?
No. And you have to talk. Use the mic.
Hi, everyone. My name is Leia. I'm Italian and Swiss, but I grew up in the United States, so I did all my education there. So a little bit about me. My background is in psychology and child development, so I was working in research prior to coming back to Geneva. My family's from here originally as well. And I decided to apply because I thought that psychologist wasn't enough for me. I think that working with patients directly wasn't something that I really wanted to do, and I think I was just thinking of things on a bigger scale, and learning from all these different facets of global health and how law falls into it and how geospatial entities fall into it was just something that was very striking to me, of how to kind of think of health holistically and pull from all these different angles. Something that we talk about a lot is that rather than working in separate silos, of kind of collaborating with people who are economists and lawyers and doctors and all that stuff, which has been great from the program, is we're a small group. We come from all over the world, and we all have different backgrounds. So it's really nice when we get to work on projects and people have different skill sets than me, or I are better at certain things than other people, or they're better at certain things. So it's great to kind of collaborate and be in this environment where we all learn from not only the professors, from each other as well. I'm currently in my second year. I'm doing exchange at the Graduate Institute, still here in Geneva. I recently finished internship, and now I'm working with this NGO as well. So, and a lot of that comes from the things that I've learned from the program, and being able to publish papers through the program, being able to go through, I was in China over the summer with Tsinghua University. That's also something that I benefited from the program as well. So there's lots of opportunities to learn, and you know, we all have different interests, so you can kind of pull from different areas that you may like that other people don't. So that's it. Go ahead.
Thank you.
Hi, from me, I'm David. I'm from Germany originally. I did medical school there, so I graduated 2 years ago, and becoming a doctor was, for me, like, I do enjoy working with patients, but I was sure that there's more to it, and especially during COVID, but also before, through some NGO work I did, I realized that there's a lot of topics that don't really get covered in medical school, and also a lot of approaches, a lot of ways of thinking. And the main way of learning in medical school is usually, you should know this, and there's no real space for, but why? So that's something I really wanted to kind of go into, and that's why the transdisciplinary idea that they really do here kind of got me to apply. And I also really enjoyed it because, like we said, the classes are, even if everyone's there, it's 25, maybe 30 people in one classroom. So you really have the chance to question the methodology, to ask when you didn't understand it, because there's people that come from a totally different way of approaching a topic and of a way of understanding the material. And then you can really just be, I didn't get that, can you explain it again? I don't understand the language you're using, the terminology. And that was really easy to get into, even though they're completely different to what I'm used to. So I didn't really come here with a plan of, this is why I do this master and this is where I want to go afterwards. I was just sure that I don't only want to treat patients, I want to know other perspectives too. I'm still kind of at this point, so I know that I want to go back into the clinical world, but I also know that I value what I learn here. I will be doing my internship in February. I'm going to, hopefully this is still not signed, but the contract exists with the Federal Ministry of Health in Germany. So I will see that side of global and public health, and then this is just to show you, you don't have to have a plan of this is why I'm doing it. As long as you have the interest, I think for me that was always enough. Yeah, just whatever you want to know, come up to me or to us and we can have a chat.
Yeah, we'll stay here. I think even post as well, like with everything going on globally, as we all know, and especially with health, I think most of us have also not really had the struggle with finding internship or anything of that sort, which was a fear, but I think that the majority of the students have found internship.
The majority. A few struggle, but the majority are like...
I think the few struggle,
doing okay.
That's like normal.
Yeah.
But I think for the most part, based on funding, based on what we've heard in the news, there's not too much of an issue for now.
I think for internship, one issue is with, and that's a pity for Geneva, one issue is with the international UN organization. They don't have money anymore for consultancy, they don't have money anymore for internships. At the moment they have blocked actually their internship program. We have ways to work with them because with the program, myself, my colleagues, we all have contacts with people working in the field of global health, and we know that there is a lot of work in this field, and they are not allowed to have interns, but they have ways to work with us anyways. So it's, yeah, the situation is quite worrisome at the moment. But I think that's even more a reason to join a program. But it's, I mean, that's a Master of Science. We want, you know, what you learn, we want your argument to be based on science. And that's something that is quite under attack at the moment, and that's why I think it's even more important to, you know, to have the skills, to have the knowledge, to have the methodologies, and to do proper things. Yeah. Do you have any questions, or do you want to tell us why you came this evening? Are you interested in applying for the program? You are interested, but you have no questions? I mean, I told you, 350 candidacies, and we have, so I've put into place a system in order to review all the candidacies. We look at you know, every application very carefully. That's why I can say, you know, you had very good applications, obviously. I think what I look at, I mean, this year we have received letters that were obviously written in a better language than 2 or 3 years ago, but also letters that were written with the artificial intelligence and not, you know, not showing who are the students actually, who are the candidates. So because it's very competitive, well, you need good grades, you need a strong motivation, but please, the motivation can't be, you know, I've always been willing to help everyone and you know, make sure that everyone is healthy in the world. Just try to be coherent with what you are, what you have done so far, and why you are interested in this program. I always think being coherent with what you are is very important. And you can build on what you have done, all the things you have done so far. And I'm not sure any artificial intelligence program could, you know, write the motivation letter better than you do. So be confident that, you know, you can do it. Do you have other questions? Other questions? Yeah.
Do all the people in your classes come from the medical field or
Okay, I repeat the questions for because it's I think we can't hear your questions from here. So do we have only students that come from medical fields? No, the answer is no. I think in your cohort they were.
It's a big minority, but it's a minority. It's maybe
2 or 3.
If you count all medical professions, not just doctors, but nurses and other related, it's maybe
1/3.
a quarter, maybe a third, somewhere between there, of all the students. And then there's a lot of social sciences.
A lot of people who did like anthropology before. What else? What other people?
Chemistry.
Yeah.
Physics, never. I don't think I've seen.
I think we have one who's an economist as well.
Economists, sometimes lawyers.
Yeah.
Veterinary. I don't think in your cohort, but before.
There's also a big
geography
difference between some people they work before the master, and some people they go straight into from bachelor to master. It really just depends. I think we're majority. I think in our cohort they took a break, but I think this most recent cohort, most of them have gone straight from the bachelor. So it's not necessarily a requirement either to have a lot of work experience, but of course.
Yeah, again, because we receive so many applications, if you have done something in the field, well, this shows that, you know, you are really interested in working in this field. Not only global health. I mean, it might be quite difficult at an earlier stage to have worked in global health, right? But maybe in public health, maybe with an NGO, addressing specific social issues, etc., etc. So these are the kind of experience that are really relevant if you want to get selected.
Thank you.
Other questions?
You would say that this is a competitive program to get into, right?
Yeah.
And what do you think are reasons that people don't get accepted in the program?
Again, so because we receive applications from all over the place and from people with different backgrounds, I ask my colleagues from the different faculties to evaluate the applications we get. I mean, I do evaluate if we have some people with a legal background or international relations. I do evaluate these applications, but then, I have very experts in other fields who would look at your applications. They look at your grades. I mean, that's normal. They look at your grades. They look and then at your motivation. There are reference letters we are asking for as well, and what you could bring to the program, right? Yeah. But what I can assure you that we do the work very efficiently, and we look at all applications. Except if you have an incomplete dossier, you won't, forget it. Yeah, which is fair. We get too many applications to make exceptions there. So make sure your dossier is complete. Make sure that, I can tell you, we can see when you have many applications like that, you will see that some students have just, I don't know, you can see that they have applied somewhere else. Sometimes they just forget to, to change the name of the institution they are applying to. And you can see that it's quite, something, a letter that they use for different programs. If you are interested in global health, well, please, it's a difficult exercise, but you have one side to tell us why, or what you can do with your background, or what can you bring to the program. As Leah said, what we do a lot is, we compel students to work with each other, to learn how to work and do group work. And that's not really easy. Do you want to? Okay, we stop. Très bien. Merci beaucoup. Merci pour votre présence.